Okay, this session is on the future financing strategies for global health, and we have three speakers. You're most welcome, and thank you for taking the time. We're going to start with Mariam Claeson, who is the Director of Global Financing Facility. If you can please keep your comments to about 15 minutes, and then we will have an open discussion after each of you go.
Thank you so
Claire?
much. Thank you. I wish I'd been here for the earlier discussion around the landscape and the changing landscape, because clearly the Global Financing Facility is a new financing instrument that's trying to be fit for purpose and fit into this changing landscape. I don't know how much you know about the Global Financing Facility, so let me just say a few things around what it is and how we operate and what we aim to do. So the Global Financing Facility was launched at the Academies meeting on financing for development almost, a little bit more than a year ago, as an instrument that would help us close the financing gap for every woman, every child. The UN Secretary General's broader Every Woman, Every Child initiative, and it really covers the continuum from reproductive, maternal, newborn, child, and adolescent health and nutrition, that whole continuum around the maternal and newborn child. It's around the birth moment, the early child and adolescent period. And the way that the Global Financing Facility aims to close that gap is really through the combined effect of increasing efficiency gains in countries, to mobilize domestic resources in countries, to do better with complementary funding, trying to get various bilateral and other donors to align around a few results, to mobilize concessional lending, both leveraging IDA. It's set out to leverage IDA with a 1-to-4 proportion, and it is doing a 1-to-4 so far, but also buy down, higher interest loans to a lower level and pay for those interest gains. And finally, really trying to mobilize the private sector around innovative financing. So that combined effect of domestic resources, efficiency gain, concessional lending, and complementary financing is really how we envisage and estimate that the current estimated gap, which is 33 billion a year across reproductive, maternal, and newborn child health, will contribute to closing that gap. So how do we do business differently? First of all, this is a country-driven, country-powered investment case. Each country's first step is to design and really develop their investment case around the continuum. It's not another series of costed action plans that then have to look for financing, but really how do we pull that together? And the second part of this is really the financing strategy, short, medium, and long-term financing strategy. So an investment case that informs the Ministries of Finance investment case, finance plan. So that's why we are housed at the World Bank. It's a partnership. You heard my boss earlier today. I hope I don't contradict anything that Chris said earlier. Chris is the chair of the GFF Investors Group, and I direct the Global Financing Facility. So really it is to get everybody around that country-driven investment case. And as I said, the banks being hosted at the bank help us enter into the ongoing finance dialogue. That's how when we talked with WHO around this, WHO's client, as you know, Ministers of Health, the working with the bank gives us that access. But it's not just that. It's the World Bank Group's private arm to the IFC that we are engaging with around innovative financing. So there are several reasons why we feel this is a good position to be in. So it's really about smarter, scaled, and sustainable financing. To date, we are in 16 countries, but the demand is great. There are 62 countries that are eligible for the Global Financing Facility. We have worked very closely, as you probably know. One of the initiator of this was Ariel Mendes. So U.S. government has been a close partner on the GFF. And to date, what the U.S. government has been able to do is in the complementary financing. So they come in at the country level, so what we call a single sourced trust fund at country level. To date, it's not been possible for USAID to join at the trust fund centrally. That's been where there have been constraints, as you probably know well, to join in a global trust fund, but at the country level is where we're getting where we collaborate. Not yet, of course, U.S. government is part of the broader investment group, but in terms of the smaller trust fund committee, we today have Norway, Canada, and the Bill and Melinda Gates Foundation, who's partnering around the smaller trust fund. But it's both a broader global financing facility where we have many members, the countries that are engaged, the UN, the Global Fund and GOV are part of our broader investors group. But as I mentioned, we have this smaller trust fund which serves as a way for us to do the analytics that's needed in countries, to do the resource mapping in countries, to link with IDA and IBRD at the World Bank, so you get the leverage there, and to do various things that are part of the broader global financing facility. I think that I will try to be brief and leave for questions only, but let me just say a little bit more, maybe what we've learned to date from the 16 first countries that we are working in. Because it's an evidence-driven country process where you look at where is the burden, among what population groups and in what area, the money tends to go to the most fragile and higher burden areas. So if you take Liberia, Cameroon, all the money goes to the counties that are the hardest hit, whether we're talking about Liberia coming out of Ebola. The GFF money is going into building resilient systems with a particular focus around birth, mothers and newborn in parts of Liberia. If you take Nigeria, the financing from the Global Financing Facility to date has gone up to the northeast part of the country to contract private sector to provide performance-based services in very hard-hit areas. If you take a country like Ethiopia, which already has a very strong health transformation plan, then clearly the GFF is not coming in and developing a new investment case, but looking at the existing national plan and trying to focus in on the highest impact areas, but also where the barriers are the greatest. So it's really the GFF tries to take into account where countries are in the fiscal space, in the macroeconomic space, but also specifically where we can have short-term gains. The GFF builds on the results, on resource-based financing. It's the previous trust fund that I think Amy was involved in, which is also a reason why we get countries bilaterals who have sort of pulled out in some countries where they've seen the sector-wide approaches and the basket funding not by the results that they've been interested in. They are coming back in because we have such a rigorous governance and accountability mechanism here, both accountability in terms of the results to which you are committed, but also trying to find ways of validating results through NGOs and parallel ways. So, for example, in Mozambique, we are now seeing that the GFF helps bring back bilaterals around the table towards, these very clearly defined results. So we have a number of front-runner countries that we're learning from in the private sector. The most innovative and exciting kind of pilots are receiving is to do social impact bond in Cameroon, where the country have decided to have an impact bond achieving kangaroo mother care, which I'm sure you all know, one of the low-cost, very high-impact interventions for preterm babies. So the impact bond is set up with upfront private investments, and where the social or the outcome-oriented partners then pay off at the end against the achievement of certain results, but provides a risk guarantee. So a number of new ways to trying to look at how we can work, not just with the private sector around service distribution, but really around financing instruments. So maybe I should stop there, and happy to comment on any questions or respond to questions.
Thank you very much.